So David, what do you make of these responses from employees?
So we're looking at research data. And so we need to do a deeper dive into understanding what the data actually mean. Let me share with you the way I look at these kinds of surveys. So it's a 1 to 5 survey where 4 and 5 is, comfortable and very comfortable, and 1 and 2 is uncomfortable and very uncomfortable. So that's the way you do it. And typically what I do, as we do in engagement surveys and all kinds of surveys that are 1 to 5, is you add up the total percentage in that 4 and 5 category, the comfortable and very comfortable, and I kind of look at it like a grade point average. And so the grade point average would be if it's 80 or above, in other words, if comfortable and very comfortable is 80% or higher, you get an A in that course. If it's in the 70s, I'll give you a B. If it's in the 60s, I'll give you a C. If it's 59 or lower, I give you a D. Now, notwithstanding that, you're right, the last one on people who are not working, they're coming back to work, 73% are uncomfortable, but 23% are in the comfortable, very comfortable. You get D is too good for that group, right? It really failed. But the other two groups, and it's distressing, are even more troublesome because they're the ones that have done the work already during the pandemic because they were in the office. One group was they were in the office, they're essential workers probably, and they're coming back, and now they're going back even more, or they were there part-time. So the office had to change, and those are 55% are comfortable, and the other one where it was part-time is 50%. So how can that possibly be? Just imagine this wasn't the pandemic. So we're now in January, and we're running a survey on how comfortable are you in the workplace. Would you respond if you found out that 55% of your employees are uncomfortable coming to the workplace? You would actually, be in shock. You'd hope it's 85, 95% are comfortable coming to the workplace. So all of this data is significantly problematic. It's not just the one. I can understand why it might be a little bit more extreme if you haven't been to the office at all, but all of it is very, very troublesome. So either it means that organizations have not done what they need to do to make it safer, or organizations haven't done what they need to do to communicate that it's safe and give people more comfort level. But all the data is rather troublesome.
Well, I mean, absolutely, I agree with David. There's no doubt, based on the survey data and just my awareness working with our own employees in some cases, but certainly working with other organizations as well too. It really varies, and I said this at the outset, in terms of how an organization has responded to this pandemic, how they've actually worked to take a look at existing business processes. In some cases, looked at the needs of employees by actually engaging and communicating with them as well too. And providing them with the necessary tools and leadership. And this is really important as well too, because the people that are responding in this manner are responding because in some cases they're looking for leadership. They're looking for leadership either from their manager, direct manager, or they're looking for leadership from the organization. At TELUS, I know we actually have a return to work playbook. We've actually completely mapped this out from many different perspectives as well too. But our focus is to provide our employees with the information that they need and to recognize that their safety is important to us, their mental health well-being is, and how they work and engage customers is important as well too. So it's really, once again, how you react, how you respond from an organizational perspective, I think, which can help calm and quell those, and providing employees with the necessary tools to be successful.
I think David and Jose have described it and expressed it well. I think I would say is definitely we've noticed this trend across all of our buildings and all of our activities, even in healthcare. And people just assume that healthcare workers are comfortable and know what to do in some of these situations. But I do think that the organization, as the information changes, as people's perceptions change, need to react and respond continually. And we've noticed that throughout the pandemic. As more information comes, more confusion comes. Sometimes clarity doesn't come, and that then also increases the comfort level. And so I definitely think that this is some topic that is not for just the moment, but it is for the go forward in terms of how do we help support employees kind of coming back to the workplace, but feeling comfortable back in the workplace.